All right, here we go. Thank you for joining me. My name is Cathryn. I am the stroke program coordinator at Henry Ford West Bloomfield, and today is World Stroke Day. So I am here to hopefully teach you a little bit about stroke and stroke prevention, stroke treatment, all the things related to stroke that are important for the general public to know. Just a little background about myself. I've been a nurse for 11 years. I have always worked in neurology, stroke being the one main thing that has always been consistent throughout those 11 years. I have a really big passion for stroke education and prevention, reaching out to the community to get people to know and understand everything that happens with stroke. So hopefully in this session, you'll learn about the types of stroke, the signs and symptoms of stroke, and most importantly, risk factors for stroke and lifestyle modifications to prevent stroke. We'll discuss some support for family members and patients post-stroke and touch a little bit about stroke and COVID. Stroke is the 5th leading cause of death in the United States. It is the leading cause of long-term disability. And 80% of strokes, which is huge, a huge percentage of strokes are preventable. One of our taglines for stroke is time is brain. And of course, knowing all of the signs and symptoms of stroke and your risk factors may save your life and someone else's. Let's start off with the 2 different types of strokes. There are 2 different kinds of strokes. The first and more common type is called the ischemic stroke. So that occurs when a vessel supplying blood to the brain is obstructed, usually by a clot. So like I said, this is more common and accounts for 80% of all strokes. The second, less likely cause of stroke is a hemorrhagic stroke. So that occurs when a weakened blood vessel in your brain ruptures and spills the blood from the vessel into the brain tissue. And the most common cause of this is uncontrolled high blood pressure. So here's a quick graphic that shows the 2 different kinds of strokes. So you can see in the pictures, the ischemic stroke on the left-hand side, there's a blood clot that is stuck right in the middle of a plaque on the blood vessel. So it gets trapped there and then the blood cannot move further up into the brain. And the picture on the left is the hemorrhagic stroke. It shows that the blood vessel is dilated, which means it's expanding. So much pressure is put on the vessel that eventually it just kind of explodes and creates a hemorrhage within the brain tissue. Both of these are equally, medical emergencies, and that's why we're here to treat you for them. What are the signs and symptoms of stroke? FAST. This has been a big campaign from American Heart and all the other stroke associations that FAST, be fast, act fast. F stands for facial droop. So is the person having one side of their face drooping or is it numb? If you want to test this, if you're not sure, you could have the person smile. Is their smile even, uneven, or lopsided? That's a big sign of stroke. Also, arm weakness. Is one arm weaker than the other or numb? You can ask the person to raise both arms. Does one arm drift down? This can also be done in the leg, but it's more common to have a weak arm than a weak leg. Next is S, stands for speech. Is the person's speech slurred? Or are they unable to speak or hard to understand? Ask the person to repeat a simple sentence is a great way to test this. T stands for time. This is probably the most important thing to do if you notice any one of those 3 symptoms. Call 911 right away. If the symptoms don't go away, it's important for the person to get to the hospital immediately. There are some additional signs and symptoms of stroke. These are worth mentioning because they do happen. They're a lot less common, but also spreading awareness about the less common signs and symptoms is also important. All of these, the key thing is sudden. So these things happen very quickly. Sudden numbness on one side of the body, face, arm, or leg. Sudden confusion, trouble speaking or understanding speech. Again, very sudden. This happens quickly. And and is not typical for the person. Sudden trouble seeing in one or both eyes. This could be blurry vision, foggy vision, complete loss of vision, vision only on one side, and then sudden trouble walking. This means dizziness, loss of balance, loss of coordination, and sudden severe headache can also be a sign of stroke. Again, this would be a sudden severe headache with no known cause. Those are the additional signs. Time is brain. So really important to call 911 immediately for stroke signs or symptoms. Don't wait. Don't get in the car and have someone drive you. It's really important for EMS to take you to the closest emergency department. Hopefully it will be here because we gotcha. They can call the hospital ahead of time and let them know that they are bringing a possible stroke patient to the door. So this allows the emergency staff to be waiting quite literally at the door to receive you on the ambulance stretcher to move very, very quickly. It's important for EMS to know the last known normal time or the time of symptom onset. Everything for stroke treatment is based on last known well. So that's the key to unlocking all the different treatment options for stroke. So luckily, Henry Ford West Bloomfield specializes in advanced stroke care. We are accredited as a thrombectomy capable stroke center, which I'll talk about in just a minute. So mechanical thrombectomy is a treatment option for those with one of those clots in a large vessel in your brain. If you have symptoms that indicate that you have a large vessel clot, come to the hospital, and it is determined that you have a large vessel clot, you can have a mechanical thrombectomy. This has to be done within 24 hours of symptom onset, so getting here right away is key. And you can see in that little picture, that's a blood vessel, and the dark red part right in the middle of the vessel is the blood clot. And you can see there's a little silver web that is going through the blood clot. That is the device that's used to remove the clot. So what happens when the special neurointerventionalist, we have 3 of them here, they insert this device through typically your groin, and they thread it all the way up into the large vessel in your brain, and they deploy this device to kind of grab on and loop up to that clot, and then they remove it and pull it all the way out, and then the blood flow in your brain is restored. Really, really great life-saving treatment. We've worked really hard to be able to do that here, and something that we're very proud of. So we're also certified to treat ischemic strokes, the clot in your brain, with TPA, which is called Alteplase. That medication has to be given really quickly, 3, sometimes 4.5 hours. And that drug, when it's put in into your body via an IV, the main goal is for it to dissolve the blood clot, and that will restore blood flow to the brain too. In order to have either of these treatment, you have to meet a bunch of qualifications, and getting to the hospital quickly and determining if you are able to have those treatments are the key things that we look for and we work for. Okay, let's get into risk factors. This is probably the most important thing and biggest takeaway that I'd like you to have from this little talk. So we'll talk about non-modifiable risk factors first. Those are the things that you can't change. They are just parts of you, parts of your life that that make you at greater risk for having a stroke. The first is age. The older you get, the more likelihood of your chance of having a stroke. Also gender. Females have a greater likelihood of having a stroke for a number of reasons. I have a slide on this in just a minute. Race. Certain races, African Americans and Asian Americans, also have an increased likelihood of stroke. Family history of stroke. If someone in your family has had a stroke, that just unfortunately puts you at greater risk of having a stroke too. And then if you've had a stroke already or a transient ischemic attack, which is a TIA, that makes you at greater risk for having a stroke. The good news is a lot of these, remember 80% of strokes are preventable. So controlling these modifiable risk factors, taking a look at your medical conditions and managing them can prevent you from having a stroke. So that's high blood pressure, high cholesterol, diabetes, tobacco use, alcohol use, physical inactivity, obesity, heart disease, and atrial fibrillation. So all of those, that big long list on the right-hand side, are all of things that you can modify with lifestyle changes, medication, with your doctor. All those are ways that you can prevent having a stroke. Okay, so high blood pressure is the #1 cause of stroke. Having uncontrolled high blood pressure just increases your likelihood of having a stroke. So normal blood pressure is below 120/80. So that's the ultimate goal of blood pressure. And people with high blood pressure are just putting their body at greater risk for that ischemic stroke. And when you have a hemorrhagic stroke, that bleeding stroke in your brain, usually that's due to high blood pressure. Your blood pressure builds and builds and builds and builds. And then eventually the blood vessels can't handle it anymore and just kind of burst. So interesting fact is that 1 in 3 American adults with high blood pressure don't even know that they have it. So this is where primary care and preventative care are really important to reducing your risk for stroke. So following with your primary care doctor regularly is very important. And then another interesting fact, at age 50, people without high blood pressure have a life expectancy of 5 years longer. So if at 50 or around the age of 50, if you have high blood pressure, getting it controlled will increase your life expectancy. Let's talk about women in stroke. This is something that I have a passion for. Strokes kill more women than men, and more women have strokes than men. 1 in 5 women has had a stroke, and women are at higher risk due to a multitude of reasons. Pregnancy, preeclampsia, the use of birth control pills, hormone replacement therapy. More women have migraines with aura and atrial fibrillation. So the general fact about women in stroke is that women live longer, and the longer you live, the greater the increase in your stroke risk factors are. And as you age, the more likely you are to have a stroke. So unfortunately, we live longer, and that puts us at risk for having a stroke. I'm sure some of you have heard of a TIA. It's called a transient ischemic attack. And sometimes this can be called a mini stroke because symptoms last minutes to hours and are completely resolved by 24 hours. What we want to consider this is a warning stroke. A TIA often comes before a full-blown stroke. In fact, 12% of the time before a stroke, a TIA has happened. And then 9 to 17% of people have a stroke within 90 days after TIA, which is a really big percentage. Again, just like we talked about FAST, that T is time. Call 911 right away and seek medical attention if you're worried you've had a TIA. One of the other modifiable risk factors is, lifestyle changes, having a healthy diet. American Heart and American Stroke Association have a lot of really, really great recommendations for brain healthy diet. Here are a couple of them. Adding more color to your diet. Fruits and vegetables have a lot of really great nutrients, and they give a lot of powerful nutritional boosts. They are typically free of trans fat, saturated fat, and are low in sodium. They don't weigh you down. Fruits and vegetables are low in calories, and they contain more fiber and water. Of course, picking superfoods and loading up your plate with fruits and vegetables can just make you feel better. And then focusing on good fats. Of course, fat is necessary, especially for brain health. Choosing fish, nuts, avocado, and choosing different kinds of oils like olive oil, peanut oil, sunflower oil, sesame oil. Those are all great alternatives. Another risk factor that's important to control for stroke prevention is physical activity. Trying to get 150 minutes per week of moderate intensity aerobic activity. That's the standard guideline. As long as you are moving more and sitting less, any kind of movement will be helpful. Slowly increasing intensity of working out is also a great idea. Of course, if your doctor recommends it or feels that you're safe to do so. Adding muscle and muscle strengthening activity and resistance, weight training 1 or 2 times a week is also a great way to get physical activity in. Overall, increasing your physical activity increases physical health, which automatically decreases your likelihood for stroke. Let's talk about life after stroke. A lot of the times, rehabilitation is key. There might be a long road of recovery. Most patients require some kind of rehab after, not necessarily always true, but going to a rehab center could be a possibility, having rehab at home, or going to outpatient therapy, both physical therapy, occupational therapy, and speech therapy. And there are so many resources out there for stroke survivors and their caregivers to aid in navigating recovery. Prevention, of course, for strokes after you have an initial stroke or TIA is the goal. Following up with a stroke neurologist and primary care physician is important to manage risk factors and guide all the care. Caregivers, a lot of stroke survivors have a caregiver at home. More than 53 Americans are caregivers, and caregivers need care too. Fortunately, the American Stroke Association has tons of community resources. I put a couple links and phone numbers here. If you are a stroke caregiver or know somebody that is, these are really, really good, supportive places to get a little bit of extra help. Stroke.org, which is the American Stroke Association website, has links for local support groups, caregiver guides, tips, tricks, checklists, all that kind of thing. There is also a stroke family warm line, and they're certified specialists in stroke that can provide information, support, or just a listening ear. So someone to call if you need someone to talk to. So important to find other people who are experiencing what you are, both survivors and caregivers, and build up a community of support. Since COVID-19 is a part of our everyday life now, really important to talk about this too. Henry Ford West Bloomfield is here and we are ready to help. In an emergency, get to the hospital. Don't wait. Don't be hesitant to come in if you think that you have an emergent situation. Hospitals are still safe. Call 911 right away. EMS is still functioning as usual, getting to your home or your facility as soon as possible and transporting you to the closest place. We have 9 Henry Ford ERs, and our teams are experienced, of course, and ready 24/7 to take care of you, especially for stroke. We have new standards in place for all patients, visitors, and staff. They are screened when they enter the building. Masks are worn at all times by patient, staff, and visitors to minimize your risk of exposure. I have my mask right here, only taking it off because I'm in front of the camera and in a room by myself. But otherwise, masks are worn all the time in the hospital. And always remember that primary and specialty care visits are available via video visit. So clinics can get those set up virtually for you if you're not comfortable coming in. But please don't wait. If you need help, medical help, seek attention right away. We are here for you. We will take care of you. So in conclusion, this is the last little bit. One more graphic for you to take a look at. When a stroke strikes, act fast. face, arms, speech, time, call 911 right away. All right, quick quiz. See if you remember anything. Signs and symptoms of stroke. Here they are. Fast face, arms, speech, time, sudden dizziness, difficulty walking, vision changes, or severe headache. What should you do if you see someone or you are experiencing those signs? Call 911 immediately. Stroke is a medical emergency. There are lots of things that we can do for you. Last one, what can I do to minimize my risk of stroke? Control your blood pressure, cholesterol, blood sugar with medication or lifestyle modifications. Also, eat a healthy diet, exercise, get good sleep, try to reduce stress, and follow with your primary doctor regularly. All right, hope you guys have a great rest of your day. I hope you learned something. If anything, that stroke is a medical emergency. Call 911 right away. We'll take good care of you.